Now at 4:30, you ask, we answer. Changing federal guidelines are adding to the confusion about who can get the COVID vaccine and when.
So state of Illinois and city of Chicago leaders say they're preparing to step in with their own plans just to make sure people still have access to the vaccine. NBC5's Christian Farr on the story live in Rogers Park, where a local pharmacy, Christian, says it's already starting to feel the impact of this confusion.
Yeah, they're feeling it right now. We're going to get to them in just a minute. But there is a lot of vaccine confusion nationwide as a result of changing guidelines concerning who should receive the vaccine. Now, many states, including right here in Illinois, are taking those decisions into their own hands. Now, late last month, the director of the Illinois Department of Public Health issued a letter talking about the confusion that is coming from the CDC. The director said his department is reviewing national and state data to figure out guidelines for residents in Illinois, saying in part that the IDPH will provide our own specific guidance by the end of September to help Illinois healthcare providers and residents make informed decisions about vaccination and protecting themselves and their loved ones. Right now, COVID vaccine guidelines are focused on those 65 and older, along with those with underlying medical conditions. The city of Chicago says it wants to vaccinate everyone 6 months and older.
We are planning to the city of Chicago to get COVID-19 vaccine, the updated one, hopefully have it by the end of this month or early October. And so that at our immunization clinics, we're doing lots of community vaccine events for COVID and flu this fall. We'll have COVID vaccine at those events along with the flu vaccine, so people can come to us if they're facing any other barriers to access the COVID vaccine.
Christian, so how is the medical community in Illinois responding to some of this confusion? I hear the city wants to get it out, but I know a lot of people are confused about this. How about the medical community?
Yeah, doctors are really concerned that because you don't have really solid guidelines, that there's going to be a major spread that could happen of COVID, and they don't want that to happen. There's also confusion and unknown right now if insurance will pay for the vaccines.
We know that whenever you put barriers in front of patients, it makes it harder for them to get the care they need. And it's clear at a time when we see COVID activity going up in many parts of the country that this is not good for our overall health as a society. More people will get COVID and will end up having complications of COVID.
Christian, let me talk about pharmacies, because I know you had a chance to speak with an independent pharmacy where you're standing there about how they're trying to navigate these changes. We know a lot of people are asking questions. We can see them searching online. What are they telling you about the vaccine guidelines? What have they told you about how they're navigating the confusion?
Well, they're trying to still navigate this confusion without solid guidelines right now. So this pharmacy behind us, they were specifically going to assisted living facilities, nursing homes, and administering the vaccines. Well, all of those guidelines have changed and create a great deal of confusion.
Who's going to qualify in that setting? We have senior citizens. They're no problem, but now it's all the other people that fall below 64. Will they qualify? The forms will have to be redone. The forms will have to have all the extra questions in regards to which chronic diseases they have to make sure they qualify before we can even give them the injection.
And of course, you can see the confusion there. The city of Chicago says that the CDC advisory board is scheduled to meet on September 18th and 19th, and that's when they think these recommendations will come out. But again, they're planning to have their own COVID and flu vaccine clinics. They'll have that information hopefully by the end of the month. And again, they're going to offer that to anyone 6 months and older, and they won't turn anyone away. Reporting live here in Rogers Park, Christian Farr, NBC5 News.
All right, that's at least some sort of answer.
A little bit of clarity.
Yeah, just a little bit in that one particular case. Thank you so much, Christian. I know there's much more to follow as the weeks go on.